Neurobiological impact of trauma. I've already briefly talked about how stress hormones can go up, autonomic nervous system can go up, parts of the brain shut down, but there are also some long-term effects that can occur. With adults, if a person is, let's say 30 years old, and they've suffered trauma, and they don't receive any treatment for 30, 40 years, and then they go for appropriate trauma treatment, the changes in the brain can be reversed. However, with children, the story is a little bit different. Humans are born with a partially developed brain, and we do not reach adulthood until approximately the mid-20s. So when we do research on brains, we do research on rats as compared to guinea pigs. Rats are born with a partially developed brain like humans. Guinea pigs, on the other hand, are born with a mostly developed brain. You may have heard the term epigenetics. Epigenetics refers to the interaction between the genes and the environment, how environmental factors can trigger certain genes to turn on or, not turn on. So with children and their developing brain, if a child is traumatized, there can be an interference with the developmental task that is going on at that stage, at that period of time that the child had experienced that trauma and became traumatized. So prompt treatment is particularly important for children. Now, it doesn't mean that children that don't receive prompt treatment can't heal, but actually the children that will have the best results are the ones that receive prompt treatment that is developmentally appropriate and trauma-informed. Developmentally appropriate treatment means that it is appropriate for that stage in terms of how the therapist speaks, the language, the cognition, understanding children's memory, understanding their emotional development, understanding their play, understanding their sexual development, all the areas of development. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children and where they have continued to act out sexually. No child wants to grow up to become a sex offender, and most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find a therapist that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.